Greetings and welcome to Premier Lab Works. My name is Josh Martinez and I am joined by my colleague Shwana Piggy, who will be guiding you through a virtual tour of our clinical laboratory facility. We hope you enjoy your time with us, and if there's one thing that we ask you to take away from this presentation is that at Premier Lab Works you will always get results you can trust.
So to begin our presentation, we wanted to take a few minutes to tell our audience who we are. We are a hospital-based clinical laboratory, part of the Premier Hospital Network. We are very new to the market, only established earlier this year in 2019. Our main facility is located in the heart of Washington, D.C., as depicted by the star on the map in the lower right-hand corner. Because our main clinical laboratory services are hospital network, we are open 24/7 to meet the needs of our emergent and inpatient community. We also have several outpatient phlebotomy draw sites throughout the Washington, D.C. metropolitan area that are community-based and service the surrounding Virginia and Maryland metropolitan areas. These outpatient phlebotomy draw sites are denoted by the red triangles on the map below. Premier Lab Works is a high-complexity testing laboratory capable of performing routine clinical chemistry testing, comprehensive therapeutic drug monitoring, basic hematology and coagulation studies, routine urinalysis testing to include microscopic evaluation, routine immunology and serology testing, immunohematology services, and a robust point-of-care testing program. As part of our scope of services, we offer a wide range of blood products to our specialty clinicians. Such products include packed red blood cells collected and stored in cpda-1 anticoagulant, fresh frozen plasma, thawed plasma or 5-day-old plasma, which is relabeled FFP, not used within 24 hours of thawing, and single donor apheresis platelets. We also offer RHD immune globulin for expecting mothers at risk for hemolytic disease of the fetus and newborn, and a wide range of product modifications such as irradiation for the prevention of transfusion-associated graft-versus-host disease, washed RBCs and platelets to reduce the risk of anaphylactic or febrile non-hemolytic transfusion reactions, and pathogen reduction technology for platelet products for enhanced risk reduction of transfusion-transmitted diseases. At Premier Lab Works, we are capable of servicing our community regardless of age. This means that our diagnostic capabilities are well defined to interpret laboratory results from patients as old as 1 day old through adulthood and even older. Our mission statement at Premier Lab Works is very simple. It is to provide our customers with high-quality, evidence-based, and patient-centered clinical laboratory results using state-of-the-art diagnostic equipment and consultation services, thereby expediting treatment regimens regardless of age, sex, or socioeconomic background. Our vision is subscribed to our laboratory management and our staff, and it is to become the most trusted, reliable provider of clinical laboratory diagnoses within the Washington, D.C. metropolitan area, and to lead the industry using innovative approaches to laboratory medicine. At Premier Lab Works, although we are CLIA certified, we subscribe to the gold standard of accreditation and inspection agencies in order to align ourselves with other industry leaders in clinical laboratory medicine throughout the region. As a seal of quality, we subscribe to the College of American Pathologists for our overall laboratory accreditation program. For our immunohematology section, we subscribe to the AABB as the industry leader in quality for transfusion medicine. Because we operate a blood bank within our laboratory and make blood component modifications, we are subject to inspection by the Food and Drug Administration as an added level of quality. Lastly, as part of the Premier Hospital Network, we are subject to inspections and patient tracers by the Joint Commission as it looks at quality from the perspective of the entire healthcare organization. At Premier Lab Works, we offer a very robust testing menu. In our routine clinical and chemistry urinalysis section, we offer statin routine electrolyte panels, routine thyroid stimulating hormone or TSH, statin routine therapeutic drug monitoring of vancomycin, peak trough random, statin routine dipstick chemistry urinalysis evaluations, and statin routine microscopic evaluation or urinalysis. In our hematology and coagulation section, we offer statin routine complete blood counts or CBCs, statin routine manual WBC count and differential, routine erythrocyte sedimentation rates or ESR, statin routine prothrombin time or PT, statin routine activated partial thromboplastin time or APTT. In our immunohematology section, we offer statin routine ABO-RH typing, statin routine antibody screening. If that's positive, then we offer statin routine antibody identification, statin routine direct antiglobulin test or direct Coombs testing, and statin routine cross-matching with any of our blood products that we're issuing. In our immunology and serology section, we offer several tests that are all batched with a 24-hour turnaround time. These tests include rapid plasma reagent or RPR, rheumatoid factor, infectious mononucleosis, and anti-nuclear antibody or ANA. And lastly, our robust point-of-care testing program. Our staff in the hospital and the Premier Hospital Network have access to the following point-of-care tests: rapid influenza A and B, rapid strep A, blood glucose monitoring, urine HCG, and fecal occult blood.
Here at Premier LabWorks, in order to fulfill our testing menu as previously described by Josh, we have state-of-the-art instrumentation. The OrthoVitros 5600 chemistry analyzer is our analyzer in order to fulfill our stat and routine results in a timely manner. Next, we have the Beckman Coulter iChem Velocity Ocean Max, which is our go-to instrumentation for analyzing our urine specimens to observe for any abnormalities, such as elevated leukocytes, which may indicate a possible infection or malignancy. Our next instrumentation is our Streck ESR Auto Plus analyzer for the sole purpose of providing better quality results in a timely manner. Our Stago Star Max is our instrumentation for coagulation tests such as PT-INR and APTT. Lastly, we have our tube testing, which is our manual instrumentation used for all of our immunohematology testing, such as ABO-RH testing and antibody screening. We also have excellent service contracts with the manufacturers for all of our instrumentation for proper maintenance and maintaining superb condition of our instrumentation for results you can trust. Here at Premier LabWorks, we have an excellent management team of quality, highly credentialed laboratory personnel. Our laboratory director is responsible for overseeing all laboratory operations and is the main point of contact for other departments and organizations outside the laboratory. Our laboratory manager is responsible for overseeing laboratory personnel, the leader in the laboratory documentation, and assists the laboratory director in overseeing all laboratory operations. Our medical shift supervisors are responsible for managing our laboratory personnel during each shift and to resolve any shift-related issues with laboratory testing. Our technical specialists are important in maintaining the maintenance of our instrumentation and the SOP for each section of our laboratory testing. We have technical specialists for chemistry, hematology, immunology and serology, and immunohematology. Our core and laboratory support are the backbone of our day-to-day operations of the output of quality testing and results for our practitioners. Our specialty technologists in immunohematology are responsible for maintaining blood product inventory, perform waived, moderate, and high complexity testing. Our technologists are responsible for QC and QA of analyzers and analyzing results from the analyzers. They also perform waived, moderate, and high complexity testing. Our clinical laboratory assistants, also called CLAs, are responsible for receiving all specimens coming into the laboratory and perform point of care testing, wave testing. Lastly, our phlebotomists are responsible for drawing blood draws via venipuncture for our inpatients and our outpatients. It is important to us to maintain our regulatory certifications through our CE, PT, and competency assessments. All our laboratory personnel are responsible for completing initial and yearly CE thereafter. Our CLAs and MTs participate in PT, and our MTs also participate in competency assessments for our laboratory to maintain regulatory certifications. Laboratory safety is important here at Premier LabWorks to maintain a safe work environment for our laboratory personnel. This ensures safe testing and reliable results. Our laboratory safety plan covers all important topics, some of which include transportation and shipment of specimens, and document and records control. Epic serves as our main hospital information systems for our many facilities and is currently the platform of choice for Premier Hospital because it is user-friendly. Epic Beaker is the LIS portion for the HIS, which allows for quicker interfacing within our network. Epic being used in many healthcare settings allows for easier interfacing of results from our reference laboratories or in obtaining results from the patient's HER. Epic Beaker allows for adjustment of LIS to various procedures, reducing the need for creating new processes. Lastly, our procedure manual includes various SOPs for all of our laboratory tests on our test menu to ensure accurate and precise results when testing all specimens. It also includes documentation on QC and QA testing and reporting for quality results that you can rely on. It has been a wonderful experience sharing with you how we can fulfill your testing result needs. Here at Premier LabWorks, our state-of-the-art facility can provide you with results you can trust. We appreciate and thank you for considering us to provide your diagnostic testing needs in order to provide the best care for your patients. We look forward to working with you in the near future.